So, hello friends. So, yesterday we have celebrated the World Hypertension Day, and to make awareness regarding hypertension, we have to understand all these things regarding hypertension. So, there have been number of complication arises after hypertension. The number one is that is stroke, and which is a very leading cause of death in India. Basically, if you think about India, it is the number one cause of death in India, that is stroke, and the cause of stroke is hypertension. So it is really necessary to understand what is hypertension, which are the causes which are responsible for hypertension, and how it can be prevented or how it can be treated. That is very important because many patients we have seen that they initially they uh, go to consultant if the consultant has been prescribed some medicine. So after that they are self by themselves they are taking this medicine for a longer period of time, so it may be dangerous for these patients as well. So it is really necessary to understand the which are the factors which are really necessary to prevent the hypertension and how should be the treatment of hypertension. So see, basically, if we consider about India, there have been two important causes of hypertension. So I think that is one is increasing obesity, and second is lack of exercise. So other will definitely come causes. I will going to come, but these are the two important causes of hypertension nowadays, because in the cities we have seen that there's been number of people those who are working in the like IT sectors. They don't have this kind of physical exercise. They don't have physical so much work, so they, even though they are taking a lot of high calorie diet, because nowadays if we consider about previous days in India, so there's been a lot of things are there. People are doing so much work in work hard for their lives, so we don't see this kind of a complication at that particular time. So they this kind we can think that there was some very balanced life was there. But nowadays what happens, this kind of all this precipitation of all this factor which is aggravating the lot of diseases. So in the cities what happens, if they people don't exercise, they don't have a physical strength, and they're consuming a lot of high calorie diet. So what happens after that? So it might be they gets increased cholesterol in their bodies, and which creating the resistance toward the blood flow, and which may causes hypertension most of the time. And one cause which is again aggravating all these things, that is psychological stress. So we often see in the these societies that lot of issues are there, a lot of things are there, domestic issues, all these work related issues, and so many things which is aggravating all your hypertension. So it is important to understand which are the causes which are responsible for your hypertension. These are the on depend on these things your treatment should be treatment should be decided. It is not only medicine that will help you. Medicine just help you to maintain your blood pressure level, but it is not it is one of the thing that you are doing, that you are just maintaining your hypertension on the monitor. But if you uh, without you are changing lifestyle, if you are taking consuming medicine, it is very hazardous, because there have been many people in delusion that they are taking a lot of medicine for their diabetes or hypertension, so they are healthy. It is not. If you're not uh, removing the causes of your disease, that means that you are aggravating yourself, or you are making one risk, you are on the risk actually at that particular time. So it is important to understand your treatment should be depend upon the causes of your disease. So another also factor which is also causes the hypertension is not a two or three. There's been some family inheritance. If your family, in your family member, if you have any person who has hypertension, like your mother, father, then there have been a lot of chances to get hypertension. There have been hypertension in the next generation as well. And there have been other factors in our body. There have been our system is all the interconnected. If say for example there have been so many patients who were suffering from with kidney diseases, and due to that any kidney disease there might be other kidney diseases as well, so which is also aggravating your heart condition, or it also increases your heart blood pressure. It is called as secondary hypertension. There has been another kind of diseases, say for example in any glandular tumors, which is also responsible for your increase in hypertension. So it is important task of physician at particular time. So whenever the patient approaches to us, so we need to understand so which are the causes which are responsible for your hypertension. So again, I'm saying to you that treatment should be that if you are obese, then it is important to uh, reduce your obesity, and uh, the weight reduction, that is very important. Second important thing is that you must do proper exercise. 45 minutes minimum exercise is needed, definitely. So morning exercise, 45 minutes walking, either 5 minutes cycling, or active exercise that is needed, cardiac exercise is needed. Then diet should be depend upon your weight or your work, how you're working, your physical work all day. So it depend upon, so it will be given by your dietitian only. And another factor is that psychological, so you have to maintain your psychological states. You have to be balanced in all the sphere if you have hypertension, because there has been another co disease, that is diabetes, is very uh, near to you. Because if you are uh, hyper, if you are obese and you don't have a physical exercise, that is your most of, I'll say that 70 to 85 patient, those who are uh, then next get to the diabetes. So diabetes and hypertension, again you are making yourself at risk that you don't do this, don't just take medicine. So follow all these things, that is diet and exercise, that these are the two important things in the diabetes or hypertension. So I hope this video is helpful for you, so thank you so much.